Okay, it's Doug McCall here from the International School Health Network. We're going to start the session. I'd expected a few more people to join us, and so we probably have people join us as we go through. This session is being recorded, so people have also indicated they're quite interested in this topic, and they'll be able to listen in on the conversation. And everybody that's responded to the invitation, and it's about 75 people now who have expressed interest in this discussion about low resource countries, but also in substance abuse prevention in general. So I think we have a sense that our people are interested in using this format to look at knowledge exchange. And so I think that's a positive thing. Just to introduce the session and the purposes, today we're looking at a series of draft statements which were developed from a review of materials, research articles and reports and resources that were from a larger pile, almost 1,000 research articles and over 400 reports on substance abuse generally. We had to dig into those reports to identify low resource related materials, and so this series of statements, as you know, has been developed just to test, just to use as a device to gather our thoughts, and we will be, as a result of this session, preparing a summary. As most people on the line know, I'm seeing Marlene can't hear anything. Marlene, maybe you can just go out and come back in. Maybe that's something that will work. That might be the best way of solving the problem. I'm not familiar with this system to the extent that I can say there is a, okay, so you will check out and get back in. That'd be great. So we'll be starting out as and looking forward to you rejoining. Anyway, so this session is intended to have a discussion of the various points. It's freewheeling, roundtable kind of format. We've asked a couple of people to make some introductory remarks, and then please jump in. We're a small enough group that we're going to be able to be quite informal, and we'll just discuss the different statements as they'll appear on the series of slides that I've prepared. Just a word of definition. We've used the term low resource countries throughout this series of fresh webinars. It includes what the UN agencies often call low income or low resource countries. Sometimes small island developing states are also included in that definition, but it is the lower end of the resource spectrum that we're looking at. But also in several what people often call middle income countries, there are regions where the conditions and the economic resources are lower, and the national state does not have sufficient resources to be able to compensate or deliver specialized support. So that's the definition we've been using. It's a fairly loose definition, but it does cover the material that was the frame that we used to identify materials, and we found quite a bit, but it was basically digging through various regional reports and various more general reports. So there were a couple of specific documents that were very helpful. So we've asked 3 or 4 people to make some introductory remarks, and I'll just introduce them together, and then look at opening it up for comments and walking through the slides that are on the screen now. Wadi Malouf is the program coordinator at the UN Office on Drugs and Crime, and Hannah Heineken will be joining him and making comments. Just as everybody on the line will know, the UNODC has been is the lead agency in many ways on this program, on this issue, and has produced various materials, including their standards that they've been working with over the years. We also have Yongfeng Liu from UNESCO, a program specialist with UNESCO, and he will be making some comments on the joint document that was prepared by UNESCO and UNODC and WHO. I had expected Isidore Obot, also who works out of Nigeria and is the director of research and information on substance abuse, but he has up to now not appeared. But hopefully he will be able to join us as well. And then, as I've indicated, please join in. There's a number of experts and experienced people on this group who can also make comments, and they will be shared and used as the basis for the eventual statement that will come out of this. As I've indicated, this is a project sponsored by the FRESH Partners Group, which brings together UN agencies and donors and international NGOs. Our International School Health Network has been working with Plan International from the UK on this project, which has allowed us to gather this material and develop this draft statement that you'll see. So Hannah and Wadi, do you want to take us into some looking at an overview of how your experience has worked in terms of doing substance abuse prevention in this context, and then we'll turn to Yongfeng.
Okay. Thank you very much, Doug. Sorry, I lost the button where to unmute my microphone. I can start, and if Hannah has any sort of additions, she can at any time also interrupt me if possible. Thank you again for this opportunity. Doug, I know we have a short period of time to present on our programming, but I'll try to restrict myself to the main topic that you suggested for the purpose of this discussion, which is within low-resource countries, how changing the culture of prevention is an essential component of our work. For us as UNODC, we've been operating on a global program for prevention for the last 8 years now. The main intent of this global program is precisely to, in our mandate, to have member states, and the most member states that we're working with are low-resource countries, to see how we can move from to a more effective and cost-effective prevention modality to serve the needs of these countries. So basically, the core component, especially now that we're operating under the Sustainable Development Goals and the General Assembly Special Session on World Drug, to address the world drug problem, how can we move to a more efficient and effective drug prevention system? The main obstacle being in low-resource country as well as in other countries is the fact that there is a misunderstanding and a wrong sort of approach or a wrong etiology on which prevention responses are in place. So basically assuming that the drugs are focused mostly on, the concern being mostly focused on the drug as an issue, rather than the vulnerability that the youth during their development have to reach substance use. So we work with these member states to change that culture of what the prevention response should be based on, the etiology, the risk and protective factors, and the vulnerabilities that need to be addressed in a prevention program, as well as what sort of programs have evidence in terms of addressing these specific vulnerabilities in order to get an effective response. And this is done through the international standards of drug use that, if some of the listeners have not seen, I think it's a very useful tool for addressing the prevention system in any country. So basically, we work from a top-down approach and a bottom-up approach. We work with policymakers for them to change their perception of what is a vulnerability to use, what are the risk and protective factors in different ages of development from birth onward, and how can these vulnerabilities be addressed in different social settings through which programs where we have evidence of work, evidence of science that these programs work. And then whenever we identify a program within a social setting for a specific developmental age, what are the characteristics of such program that makes it effective and characteristics of a program that make it ineffective, so that these countries understand how can they change whatever they have in operation and how can they capitalize on what they have to make it more effective, and whatever is missing, what they can add to their arsenal to make it more effective. So this is only from a top perspective with policymakers, changing that perception so that service providers at the bottom would have an opportunity to experiment with evidence-based programs and not through programs that are just improvised by higher authorities. With the change of authorities, they would change with time. And from a bottom-up approach, we also work with service providers directly for them to have evidence-based programs adapted and piloted to the national needs, and then piloted on a small scale with a documentation in terms of their effectiveness to persuade policymakers at the top level that such programs do make a difference, and the culture of evaluation of these programs, when we implement it through the pilots that we do, would further support that collective image that we want to change in the sense of changing that culture from a policy-making perspective and from an adaptation and evaluation perspective within the country. So this is in a nutshell the work that we're doing in order to improve the culture of prevention, because this is a main impediment, after which when this threshold is crossed, the rest becomes a fine-tuning of the process in order to have a more effective system in place. I don't know if I have more time than this, but I think this is in a nutshell what the mode of operation is. But in the 5 minutes allowed, maybe Hannah would have something to add.
Yes, please do, Hannah, and thank you, Wadi.
No, thank you. I think that was very well used, 5 minutes to summarize how we work both, like Wadi said, with the policymaker level to change that kind of higher level support, also in order to slowly support changing the entire system, and then also from the practitioner level, from bottom up, to actually give those concrete ingredients, those concrete tested, evaluated, effective programs that are really grounded on evidence around which the system can then work. So I will then perhaps talk more in the discussion part.
Okay, Fang Yang, do you want to? Sorry, go ahead, Yang Feng. Yang Feng, can you hear me? Can you join us and make a couple of comments? Oh, something's happened maybe
hello.
Oh, there we go.
I was just talking without unmute my mic.
Okay.
Sorry for that.
Thanks.
Thank you again. I was saying that just to highlight a few points on the need to engage and support the education sector to adopt a sector-wide approach to substance use prevention, which actually is included in the document Doug just mentioned, the joint documents developed by UNESCO, UNODC, and WHO, and some of you here today were also involved in the process of developing that resource. I'm very happy to see you here, especially Monica and Sky. So the need for engaging and supporting the education sector, the first argument is based on the evidence that substance use most commonly begins in adolescence, with alcohol and tobacco and cannabis being the substances most commonly used by the children and young people. And there are lots of data. I'm sure you all are very familiar with the data, especially from the GSHS, saying that 1 out of 4 13 to 15-year-olds use alcohol during the last 12 months, and also the quite high prevalence of tobacco use. I'm not going to cite all the statistics. So the second argument for the education sector's engagement, of course, is the impact of substance use is not only on the health and the well-being of children and young people, but also there are educational consequences, and the booklet also documents a lot of evidences on that part. The third argument, the third point has been made is that the education can influence a wide range of risk and protective factors associated with substance use by young people, by adolescents and young people. So the role of education has been discussed about. However, in the reality, the review of the existing practice in many countries indicates that in quite many countries, the education sector, the Ministry of Education in particular, are not very much involved in the national response to substance use. Or in some countries, the education sector, to some extent, they are quite active, but they are not using evidence-based approach. They are not responding to this problem as effectively as it should be. Or in some countries, there are pockets of evidence-based approaches which are effective, but there are always challenges for scaling up these evidence-based effective responses. So why is that so? It seems that in some countries, I think this is the case with low-resource countries, with many of the low-resource countries, that some interventions are really some school-based interventions, focus on interventions really within the school at the school level, without looking broadly other factors also have an impact on the school system. That is to say that school-based interventions never happen in a vacuum. They happen instead within a system of education which involves a large number of stakeholders. And the education system is also made up of a large number of components. So from UNESCO's perspective, we are promoting a comprehensive education sector response, which should be holistic, not looking just at schools, which are only one of the elements of the education sector. So in the UNESCO, UNODC, and WHO joint publication, education sector response to the use of alcohol, tobacco, and drugs, it's advocated to have the responses framed from the perspective of the whole education system, with the main components including looking at the policies both at the national level and the school level, and also the curriculum, both at the national level, subnational level, meaning what should be taught when, where in the curriculum. And also we should also not forget about the training of teachers and other educators and school staff, and also the linkages between the school-based interventions, education, and the school health services. And of course, all the interventions within the schools, including those impacting the school environment and the classroom environment, and the teaching of the life skills-based teaching all of the social and emotional skills required by the young people, adolescents and children. And of course, we should also look at the aspects of overall management, coordination, and evaluation of the education sector responses. So this is just a few words just to as a reminder that we really need to look at the education sector as a whole system, and to have a more comprehensive and holistic approach. Thank you.
Thank you, Yongfeng, and thanks for helping us introduce this. What I'm suggesting here is that we have a general discussion of what we sort of looking at an overview of how do we approach substance abuse prevention in low resource countries. I'm going to click onto one of the next slide, which will show sort of what is our understanding of the problem, and I think our initial remarks from our speakers have started that conversation. But I'll open it up to participants online. What are your thoughts about how we need to understand the problem and how we need to understand the approach that we need to take here? Just open it up, just click on your mic and just say hello, just indicate who's speaking, and then just jump right in and make your comment, or please provide us with any insights that you have about our understanding of the problem and potential solutions. So please jump in whenever you're ready, and just if more than one person wants to talk, we'll just sort it out as we go.
Hello, this is Caroline Hilari from Save the Children. I think that, well, I'm particularly interested in the link between substance abuse prevention programs and violence in and around school, violence prevention and school-based response to violence, because we do see that the social emotional learning and the capacities that young people need to reject substance abuse are basically the same skills as the ones needed for violence, or to respond or not get into violence problems. So I think this is, I'm not trying to broaden up this topic, which is already very, very broad, but I do think this kind of comes in and is linked. That just to sort of like add to the angle that we're looking at.
Great, thanks, Carolyn. Further comments and suggestions about this, our sort of holistic understanding of the problem or potential solutions?
This is Brian Fly. I completely agree with the prior speaker. As soon as we understand that these behaviors occur in the broader, and prevention needs to occur in the broader social context, then we're also influencing other behaviors.
Great, thanks, Brian.
Doug, if I may as well, I mean, I completely also echo the same message, because this is the same message we're addressing, and we were I tried to briefly go over it. When the vulnerability that is associated with substance abuse problem is addressed, it is the same vulnerability that is associated with violence, with crime, with delinquency, with poor scholastic achievement, with poor scholastic. So basically, we're addressing a holistic approach. We're addressing a healthy mental and physical health development of the children. That's one aspect of understanding the problem. I think that should be there. The element of the schools playing a role in educating parents, maybe, but probably it's more like we use the school. I mean, the school and the family are the main two social institutions that can play a core response when it comes to the prevention angle, at least from a drug prevention angle we're approaching as UNODC. But the school could be a good recruitment ground for the families as well to benefit. I mean, the school could apply certain prevention programs in it, including life skills education and the like. But the schools could be good recruitment ground for family skills development as well. And this is the approach that we're doing. The classroom could be the meeting room for the families to benefit from evidence-based family skills programming. And this allows for an interaction between the family institution and the school, which improves on the value of each one of these evidence-based program independently. So the life skills education in school plus the family skills program, combined effect will be multiplicative rather than additive. So I think there is the element of addressing the vulnerability having a rewarding effect on several health and social outcomes, as well as the benefit of the school playing a role of catalytic model to reach out to other, to facilitate other evidence-based programs within the community.
Thank you. Further comments? Any reactions to the statements on the screen?
Hey, this is
Monica. I just wanted to make a. Can you hear me fine?
Yes, we're getting a bit of echo, but if people would just turn off your mic if you're not speaking, maybe it'll eliminate the echo.
My comment was I can hear a lot of echo, so I can't speak. I think I will come back.
Okay, I think it's your computer is picking up your microphone as well, so it's doing a feedback loop. Maybe just turn down the volume of your speaker. Thanks, Monica. Any other comments? I think somebody else came on the line at the same time as Monica.
Yes, hi, this is Hannah, also from UNODC. I just also from my behalf wanted to echo all the previous speakers on the importance of comprehensive approach and on the different aspects on what we mean when we are speaking about comprehensive approach, because everybody agrees we need to be comprehensive, but of course we have a wide range of shared mandates that in our programming we always try to build in, because the prevention of substance use really has the power to change developmental trajectories in a fundamental manner, as the previous speakers were saying. So, for example, in our own work, we have very good examples coming from different geographical regions where, for example, we are calling our work violence prevention, because that is the political priority in that area. And of course, there is a wide range of different areas, like what he was mentioning, mental health, risky sexual behavior, and school achievement. And in order to really be able to scale up prevention, I think it is elemental that we are able to utilize and find the synergy between these different areas of work, because for prevention, let's face it, we will never have enough resources, or we will never think that we will have enough resources. So really combining the work across these sectors, even if in many contexts, in reality, it might be a bit siloed, but I think that would be one crucial direction to go. And then being comprehensive, I just want to echo also what he was saying. Indeed, schools are often the kind of melting pots of entire communities, and I think that's one aspect we also try to bring forward in our school guide, that besides being key socialization agents, besides the families who really have the power to shape how children grow up and reach their key developmental goals, and of course how vulnerable or protected they will come towards risky behaviors such as substance use. In addition, they are often also very, very well trusted actors in communities and in contact with almost entire cohorts of children and young people, and as a result in contact with almost all community stakeholders in many places, especially in smaller locations. Schools can have really the power to connect families, schools, but then also other stakeholders, religious entities, sport-related entities, social care entities, and the list is long. And I think these two aspects of the comprehensive approach really play into what also Yongfeng was saying, that highlighting that for prevention, often we know what to do in classroom level. On that we have solid evidence, but the big question is how we can change that and scale that up so that the same could be done at national level, benefiting entire cohorts and really having an impact at the level of population health. And I think that's one of the crucial questions for us to discuss. In the school guide, we tried to highlight few examples of different strategies different countries have made in order to try and scale up evidence-based classroom programs. But then I'm sure there could be many different solutions to this, and it could look different in different places. And for example, just reaching outside of the substance use prevention mandate could be one way to tap into different sources of resources in order to really scale up, or connecting with various different stakeholders would be another way to infiltrate prevention really to the system. But I really think also this is something I would be very interested to hear the other speakers and members of this meeting to reflect upon how could evidence-based prevention really be integrated to comprehensive education sector systems. So, thanks.
Thank you, Hannah. Thank you, Hannah. Further comments and questions?
Hi, I don't know if you can hear me.
Yes.
Oh, hi. My name is Marlene. I'm from the Canadian Nurses Association. I'm not sure if this would be, but I know that from our viewpoint, at least, prevention is always just one piece of the puzzle with anything to do with substance use. And truly our belief that you need harm reduction to do. I know you're all speaking about a comprehensive plan. And a comprehensive plan, we really think that you need that harm reduction available for people, as well as things like prevention, treatment strategies, and abstinence, and other things like that.
Great. So not only a range of programs, but also a range of needs as well. Further comments?
Yeah.
Further comments and questions? Thank you, Marlene. Further comments and questions?
Doug, this is Monica.
Yeah.
Am I audible now?
Yes. Great. Yes.
Okay. So my comment was around various forms of use also to be considered. For example, I did see through the document, it is smoking that has been mentioned, and in some of the Southeast Asia countries, it would be tobacco, which would be more prevalent, which is including smokeless forms of tobacco. If we can look at it more broadly in terms of the types of substances that we are talking about. And my second comment was about including families in the comprehensive program. And this has a two-way impact where surely there would be education to the parents in the families, but many a times in our intervention programs we have seen where youth and adolescents have become the change agents, where they have motivated family environment and led to creation of smoke-free homes, as well as helping parents quit by using the close-knit family environment and be able to get parents to quit with the constant guidance and talking in the family.
Great, thank you, Monica. I'm going to suggest we move on to the next slide, but just to kind of sum up, I think there's a real consensus around the need for a comprehensive, multi-level, multifaceted approach, and recognizing, particularly in low-resource countries, that the school is a hub within the community. It can reach out to parents, although the actual programs that are done with parents are probably going to be off the school site or after school or whatever. But it's a recruitment device. Focusing on different vulnerabilities, as what he has said, is very important. Although I'm going to leave this section just by saying there is a bit of a dilemma, and it's not only for this sector in my experience. There is evidence to show that when you're talking to kids, particularly in the classroom, but elsewhere, the messages need to be quite specific. In this case, there needs to be some specific practical information about drugs that are challenging kids, but that needs to be put in a broader developmental context. But there still needs to be some specificity, and so it's being able to put the pieces of the puzzle together that make good sense within the community and for the young people involved. And that's the challenge of keeping that, building that culture of prevention without losing the specificity that sometimes underlies the certainly the research evidence, because in research, as everyone knows, the research gets down to more specifics and does test specific things. So there's a bit of a challenge of building evidence-based programs or moving towards evidence-based programs, but also keeping the bigger picture in mind. It's not an either or, but it is a challenge in not getting sidetracked to just trying to implement one particular program, but also going the other way and having things being so large and complex and moving parts that people are frozen because of the challenge of the complexity. Didn't want to leave this section without talking a little bit about points 6 and 7 on the screen. There is evidence in terms of that I found in my looking through the materials that in low resource countries the alcohol and tobacco consumption among young adults is relatively low compared to other countries, but that may be misleading because of the way the data is collected and so on. But I think it's a factor, and we may actually be facing what the people in the nutrition sector call a transition or to a double burden, where in some parts of a country or a region as incomes come up, there's more disposable income, and then purchasing of substances or different kinds of foods, unhealthy foods, increases. So we need to be careful not to oversell the problem, but also to be specific as we move forward. And the last one, which unfortunately Isidore is not here, I was really struck with the urgency of the marketing of tobacco and alcohol. In fact, if you have a chance to, if you're one like me who reads The Guardian most days, there's a great series on how tobacco companies are marketing their products in Africa and being very aggressive in trying to counter the legislation, laws, and so on. And there is a need, in my view, for schools to be part of that response to marketing and advertising of these products that we need to be part of, and to build things in the school day that can help to reinforce those messages. I'm going to go to the next slide, which is looking at the role of schooling in schools in low resource countries, and point one's fairly obvious and is I think true of all contexts. But if we look at what makes perhaps school systems in low resource countries unique or different, is that the lack of resources, obviously, and so that has consequences in terms of the nature and the capacity of the country to do full curriculum and to focus on health and life skills. In the context of that, even getting literacy, numeracy, and vocational preparation kinds of subjects fully operational is challenging. So is there space? One of the questions that came out, is there space in the school day where other kinds of non-curricular activities can be used to promote prevention? And the example I've cited there is how young people in schools in low resource countries learn about sanitation and hygiene and clean water by actually engaging those in activities during the school day, and whether or not that's a strategy. So is that statement valid as a generalization about this context? And then point 3, this is true of all contexts. Disruptive students are challenging for teachers in all contexts. An orderly school learning environment is very important to learning and to teachers. And so if a troubled child is acting up, then they need to be dealt with. And if they continue to act up, it's a real challenge to teach the other students. So, and that's a concern that's clear in the research about teacher concerns in this kind of area, well, teacher concerns generally. So is there a way of getting more support for troubled students, not only for substance abuse, but also other behaviors, as we've discussed? How can we ensure that there's a supportive approach rather than a punitive approach? So that's, and in this context, it may be more challenging. So open it up for discussion, comments, agreements, disagreements about those points, bring in others. Please jump in.
Doug, I would say, in bullet one, as mentioned before, is correlated with that substance use, and I would stretch it also, and positive social and health development of kids in general.
Yes, this is Brian Flay, and regarding that, some positive youth development programs give training to the teachers, as well as then the teachers delivering a curriculum that focuses on developing the positive behaviors of youth and the development of those positive behaviors and putting kids on a positive trajectory. And some of them have shown that they reduce disciplinary referrals, disciplinary problems in classrooms, disrupted behavior in the classrooms almost immediately, and then they're also reducing all negative behaviors going forward. And some of those programs also include family or parent components, so the parents are engaged as well in the whole process. And the time that it takes to engage in those programs in the basic pedagogy component is quite small and is more than accounted for by improvements in academic performance.
Thank you, Brian. Any further comments about the nature of schooling in this context and its impact? Yep, go ahead.
Hi, this is Sky from Hong Kong. I'd like to speak about point number 2. Actually, in Hong Kong, we've been trialing this using co-curricular activities as a way to introduce prevention work. And what we've found is that a lot of times, if it's presented as a positive youth development program, schools are very open to it. In fact, would really want it. But once there is a discussion about drugs or alcohol or tobacco, then they oftentimes will actually shy away from it more. So I think there is some value in looking at the positive youth development model, particularly when it comes to co-curricular activities.
Thank you. Further comments?
Yeah, Caroline again. From the Latin American perspective, I haven't seen schools and particularly teachers so open to doing what you call co-curricular activities, unless you bind them in totally into literacy or numeracy or what they have to teach anyway, because otherwise the teachers feel that it's like an extra burden to teach this sort of like as if it were an extra subject. Particularly, I'm referring to subjects related to health literacy, like hand washing or nutrition or topics like that. And so my experience is that if you can bind it in to, whatever the curriculum is for that particular age, but usually based on either literacy or numeracy skills or science skills, then it gets accepted much more. So I think that will be more of a way to go.
Great, thank you, Carolyn. Further comments about this particular look at schooling in this context? And it's obviously not you can't generalize for all regions and for all kinds of countries, but are these thoughts, can they be further developed? Go ahead.
I wanted to add that increasingly now among the education and the health sector, there are these talks about integrating programs. For example, even within health, there is a separate national program for NCDs. Then there is another program for tobacco. There is a separate school program for blindness, then for WASH. So there is now, for example, in India, there is this integration that is coming along saying a comprehensive school health program. So they are revising their old school health program to be able to integrate all adolescent health issues, because their understanding is that if we are able to give basic life skills, then it addresses many issues in one go, rather than different program officials going and training teachers and peer leaders on different interventions. So prevention, substance use prevention also would fit better, as also Sky mentioned from Hong Kong, that if it goes as a youth development model and a comprehensive school health program, then it is easier to influence education officials that there would be positive educational outcomes as well with this kind of a comprehensive intervention.
Thank you, Monica. Further comments before we move on to the next section?
Just a small comment from my end also, Wadi talk. I mean, the slide talks about the different contact challenges within the school, but there's also, especially in low resource country, there's the element of, overcrowding in some of the schools in low resource country, which also is a challenge at times. But there's also the element of lack of schooling opportunities. So for us, from the international standards perspective, something that we work on in low resource country is actually encouraging parents to send their kids to school in specific settings. Schooling by itself, being in school, is a preventive strategy, and that's one of the rules of the schools. I mean, of course, additional programs are needed within the school, but just being in school by itself in low resource country in certain cases is a privilege that not all kids have.
Okay, thank you. Good reminder as we try to understand the schooling context. And I pick up on another point that Sky and Monica pointed, the need to engage youth, and maybe that's going back to our previous slide. Youth engagement programs in this context may also be another important pillar or an important strategy for this context. I'm going to move on to the next slide, which looks at comprehensive and coordinated programs, and statement 1 there does talk about, as Brian mentioned, the positive behavior support programs, the social emotional learning, health promoting schools, child-friendly schools, school health and nutrition. There are a lot of frameworks out there that can be used to guide what I call multi-intervention programs on substance abuse. We use the terminology multi-component approaches for those larger frameworks, and then within that you can address different issues like substance abuse. So there are several frameworks, and they've been mentioned already in this conversation, which is great. Point 2, it's pretty clear. Most of the research has been done in high resource countries, so we need much more research, and particularly applied research that is able to best understand the combinations of the policies and programs and practices that can be not only implemented but sustained, and that goes back to our conversation about a comprehensive approach. So that's one finding I think that needs to be underlined. The third area in the draft statements with the feedback we got, it wasn't well stated, but most of the work in high resource countries is topic focused and looks at an issue, looks at a program, as Wadi was saying. And we need to think about whether those project or program or issue-driven approaches are sustainable in the long term. Not that we need to lose that specificity, but we need to ask, and I think be able to study whether or not those programs last beyond much beyond the program funding that is provided by a donor or by a research project. And then point 4, I think we've talked about quite a bit. And point 5, the examine the status of the programs. As going back to Monica's point, the status of a well-developed health and personal and social development curriculum in countries is largely unknown. Some countries track what is actually being delivered, what is feasible, what is, many countries will have some sort of core curriculum that's defined, but as to its implementation or maintenance, there's not very much information available. So that as people work towards that integrated approach, as Monica has described, we need to be able to track whether or not progress is being made, because that is the home of these kinds of interventions. So comments, questions, reactions to those 5 points, anything that jumps off the page that people would like to jump in on? lots of agreement on these 5 points for the comments, or can we just accept that everybody seems to agree with that kind of, we need those comprehensive coordinated programs?
Yeah.
Okay, I'm going to move to the next slide. Easy to say and hard to do, though, I think, is maybe we'll leave that with comment as we move to that slide. This is teasing out the different elements of the comprehensive approach. That's one finding, that it goes back to the tobacco point I was trying to underline before. There are government efforts to reduce the attractions of tobacco particularly, but also alcohol as well, restricting access and advertising and so on, the e-cigarettes and single cigarettes, so lots of different strategies used by tobacco companies. But this point tries to bring that into the school setting to be able to use that and to reinforce those messages. Not sure if there's going to be much discussion at this point, but is that a feasible strategy? Can those kinds of school-based activities reinforce what the governments are trying to do in the larger policy sphere?
Yes, this is very important from the school setup, because some of the policies which are on youth access, for example, there is legislation saying no sale of tobacco or alcohol within certain distance of educational institutions. So when these kind of legislation are flouted by the vendors or retailers, then school has the authority to take action in some jurisdictions. So I think some amount of youth advocacy, building up skills to be able to see such violations, and for the school authorities to be able to take this matter up with the law enforcers have been some of the activities that have been undertaken in Southeast Asia region.
Thank you, Monica. Further comments?
No, it's Wadi from my end. I would say, like, even though it starts with linkages between overarching governmental policies, it seems like whatever is suggested here is within the school, but there are also overarching governmental strategies that are around the school that could further help these. I mean, taxation on tobacco, especially among the youth, is important. Restricting the age when you can purchase alcohol, tobacco, alcohol-free community, alcohol-free zones around the school, but probably could be integrated as additional, because it looks like what is recommended here is within the school sort of implementation.
Excellent, thank you.
Policies in terms of how to deal with drug use in the school as well, and how it's linked to further maintaining the kids in school rather than just kicking out kids from school. Probably Hannah or Yongfeng could elaborate more in terms of this is like also a school drug policy. I mean, you hint about smoking, but also drug-related issues and availability of programs on the indicated level for, in the case of kids that are already engaged in system, having social workers to deal with this situation, to maintain the child in school as a policy as well. These are also programs that could probably fit here.
Excellent, thank you. Certainly broaden it. It is in the host document, but it's not here in this statement. We can broaden it back out. Thank you.
Hi, this is Sky. I think that with this particular point, what I would also like to add and emphasize is not just about having the policies in existence, but actually is how it is then enforced to happen. Because a lot of times what we're seeing is that, you know, you will have a policy in place, but whether or not it is being followed and what the repercussions are about that, you know, is what truly will make the impact. So I would really say that, you know, it's not just about having the policies, but then also how to monitor and also to make sure that the policies are actually followed.
Excellent,
yeah,
thanks.
I agree as well. Yeah.
Further comments? I think this one is too narrowly focused on advertising and commercialism, and we need to have another point, I think, about policy, the way that Wadi and Sky have just mentioned here, to reinforce the need for school policies to be integrated within larger countrywide policies.
Mm-hmm. And if I may just add that within the policies, also the linkages to healthcare appear to be quite important. So good referral and support system relating to substance use and mental health issues within the school healthcare system, and well-functioning referral systems to the healthcare and social care systems outside of school units are often also good components of policy approaches at school level. Even if it's, perhaps that was coming up in your next slide, because I see that this was really limited to access and advertising on use, but since we are broadening it up on school level, that's also, of course, crucial aspect.
Yes, I think good point, and we will move on, as you suggest, to other slides, and I am getting conscious of time. I'm going to assume that most of us can stay for another 15 or 20 minutes. We've now reached the hour mark. But we have a couple of slides to go, so let's try to do the scan and come back as well. These points here are on the curriculum and instruction. I'm not going to repeat them in terms of, but we as I indicated earlier, I think there is a need not only in the low resource countries, but to understand what actually is being delivered in terms of core curricula, co-curricular, and so on. Teacher education is like in all contexts is usually been topic specific and quite project driven, and we need to try to understand how much is actually being delivered. And then there are examples. There are some examples of instructional programs that have been adapted to low resource countries and have been evaluated or seen by participants as effective. And how can we do, the question here is how can we share? The last point in point number 3 that was mentioned in our last webinar was, are there ways to get past the copyrights and publishing controls that are often used by these individual programs to keep going? How can we get past those barriers, but also to enable those programs to keep on going? It's a bit of a dilemma, I think. Questions or comments about this piece?
Hello, this is Sky. Regarding the third point, I think this is something, I don't know if it's possible, but I think, if the intention of a research project is so that the models can be actually adapted, I think that, there must be some components of the original research project that must include factors that are relatable in low resource countries as well. So, for example, an example would be, different cultural contexts in which an instructional program is being delivered in, so that, when you look at, the original program, it can be transferable in some ways, because if it's completely different, even if it looks like it's a positive program, it may not be applicable at all to a low resource country.
Thank you, Sky. Yes, and that addresses the issue of fidelity, which is often a concern of the researchers, for sure. Further comments, questions on these points around curriculum and instruction and co-curricular activities? Okay, I'm going to move us to the next slide, which is continuing with the services angle. We need more examples of school-based and school-linked services in low-resource countries that need to be assessed and shared for insights. Point 2, that we need to try to articulate some reasonable and realistic practice-based standards for these services. Point three was it's not only for low resource countries, but there is a debate in the systematic reviews about the effectiveness of brief interventions and motivational interviewing that needs to be, I think, considered not only for this context, but particularly in this context because of the low cost or cost effectiveness, potential low cost and cost effectiveness. But some of you may know, we track the research reviews quite thoroughly, and there's quite a few that have had mixed results in terms of brief interventions. So that may be a step that can be warranted. And then a lot of the reports also talked about the use of mobile technologies. Obviously, linking the use of mobile technologies to school programs is important, but I would also think, based on our experience in using tech in other situations, we need to be able to make sure that the technology does indeed reach all of the students. So that would be my comment about point 4, web-based services. Is there comments or questions about health and other services related to substance abuse in low-resource countries? Anything else that is missing from this page or that jumps off the page as being not quite right?
Yeah, this is Caroline again. I think in low-resource countries, you need to sort of broaden up the concept of a psychosocial service. In many places, you don't really have that. There are two directions that I would like to broaden this up. One is community-based protection. Well, I wouldn't even call them services, but things like village committees in certain countries, like we have some examples from Nepal and from Mali, where community, village committees for child protection actually get quite active, and those could be structures in the community that could replace the non-existing psychosocial services. On the other hand, I think we need to talk about the justice system. I mean, most places, drug abuse is directly, related to the criminal justice system, and criminal juvenile justice systems are very poor and very problematic to work with in most low-resource countries. So, we need to make a link between the education system and those justice systems, but at the same time improve them so that they don't become don't only lock up those kids into horrible prisons.
Thank you, Caroline. Further comments or questions about service delivery? Good suggestions, both. Okay. I'm going to jump again to the next component, which is social environment, social support. This is where parent and family programs are, as mentioned, point 2. A little bit relates back to the comment from Caroline, the drug searches and testing. There were several reports that mentioned that. We need the drug searches and testing has been examined in high resource countries, which need to be, that research needs to be transplanted and done again in low resource countries. It is a practice in several, at least in terms of several of the situation reports that I reviewed for this project. Point 3 had some discussion in the responses. It's not perhaps well stated in the draft statements that went out, but it goes, I think, back to our earlier comment about putting substance abuse within a broader context of vulnerabilities. It's much better said, he said it much better than the draft statements, and so point 3 may not be as controversial as I thought it might be in this discussion. And then mass media programs. There are research reviews that have indicated that mass media as a standalone is not effective. So linking them carefully to to both the life skills education and school activities and parent information days and so on needs to be done. So those were some of the comments that have come out both from the review and in the responses to date. Comments on these forms of social support and the social environment in the school?
This is Brian Flake. Can you hear me?
Yes.
Oh, good. I was off for quite a while figuring out the system.
Yeah, you've been in and out, I think.
Yeah. The point 4, I'm not sure if we have evidence that mass media alone has no effect in lower resource countries. We know that's true in higher resource countries, but
yeah, no, I'm sorry, you're right. That needs to be clarified. Yes, it's
yeah. And you know, mass media has different meanings in different contexts, obviously, but in some lower resource countries, I would expect that mass media is a limited product, has limited reach, or rather there's limited numbers of channels that people have access to. And so it might be easier to target messages in lower resource countries than higher resource countries.
Okay, thank you, Brian. Yep, good comment. Further reactions to these points or to the general topic of generating social support through parent programs, media, community involvement programs?
I'll just say a bit more about media programs. If media messages are framed in a way that gets people discussing the issue within villages, for example, then they can have big effects.
Yes, and that's where the standalone becomes not standalone.
Right.
Yeah. Great. Further comments about this area?
Doug, I will go to Swati. I will go to point number 1, and it's not a matter of only like the status of the effectiveness. I mean, of drug testing in school that needs to be investigated, because like the evidence is there in terms of lack of effectiveness of these programs, even in high resource countries. And beyond just like the effectiveness, there's the principle of these programs and the logic upon which these programs are based that is at stake here. Retention in school by itself is a core ingredient of effective prevention response. So drug testing for the purpose of it needs to be contextualized. What sort of drug testing needs to be investigated? There's an overuse in certain instances, especially in low resource country, in drug testing in terms of a modality of screening kids out of school because of that problematic. And this, from a prevention system perspective, from an evidence-based perspective, is not an effective way to address the drug response in the country in general. These kids did not disappear from the radar. They're just not in school, but still are vulnerable and have that problematic. So probably this sentence probably need to be addressed in a specific way, in a different way, because if it is really like raised as a recommendation, I think the issue of drug testing, I don't know if Hannah or Yongfeng can help me in this, is a bit of a sensitive issue beyond just its effectiveness that shows lack of effectiveness. It's a matter of principle of logic of as I said, the culture of prevention that we're trying to implement. I don't know if I made myself clear on this one.
No,
but testing and effectiveness of something that is already tested that is ineffective in another country, if it's like drug testing for screening kids out, and as a matter of principle, might be misunderstood under bullet number 1.
Yeah, and I'm seeing comments in the instant message box. Yeah, no, I think that's it's not stating the need and the problem effectively, certainly, and we can rewrite it to say that. I was trying to be a little bit neutral because there seemed to be a fair amount of attention to testing in the reports that I was reading, and was not trying to be too critical, but certainly the research that has been done indicates that it's not effective, and certainly from a principal point of view of keeping kids in school, a primary protective factor, you're right. So we probably need to rephrase that in a way that's more appropriate. Further comments? I'm just going to... And Caroline has suggested some wording there in the message box. Further comments about these areas of social support? I'm going to keep pressing on, and we'll have a chance to look again at this in terms of when we start to draft a summary. There wasn't much discussion in the initial draft of the statements about physical environment and what I call practical resources, the things that are in or near the school to help the physical environment. But item 2 I thought was particularly important. I'm not sure how that plays out in low resource countries, but certainly it is applicable to other contexts. And item 1 might be a little more relating to countries that are facing conflicts and recovering from conflicts than quote unquote low resource countries, but it's certainly a challenge for that context. It's discussed quite a bit in the research about conflict afflicted fragile countries. Comments on the physical environment in and around schools that people would like to add? Anything unique about the low resource country that needs to be considered? Silence may be consent for that. I wanted to just go to implementation and operation and scaling up, and the scaling up of interventions is I think a real challenge, not only for low resource countries, but the draft statements included the systematic approach, and Caroline, you were one among others calling for much more practical kinds of things. I'll try to address a little bit later on, but in the slides. But the idea that rather than trying to introduce and implement and maintain programs that have been developed in high resource contexts, the idea of being able to pick your spots based on opportunity and based on resources in the community to be able to continuously improve the quality might be a more realistic and feasible approach, rather than trying to implement 1 or 2 or 3 particular programs. So that's the meaning of number 1, and point 2 and 3 are really related to the comprehensive, the infrastructure. I think everybody online is familiar with the FRESH pillars of having policy, instruction, support services, social support, and the physical environment. But we don't really know, in most cases, what is the infrastructure that does exist for delivery of programs such as substance abuse prevention. And there was also a comment in the responses that in the FRESH materials that are online, the indicators for substance abuse definitely need to be updated and revised. Comments about the challenge of implementing and maintaining and scaling up capacity and sustainability of programs in this context? Do these 3 points capture some useful thoughts? Are there other thoughts that need to be added? Okay, we're getting close to the end. I think people are ready to I'll just go to the third one, and that sort of builds a little bit on the previous slide. there is a shift, and it was certainly clear in the materials that we've identified at the beginning of this session, the UNESCO, UNODC, and WHO guide, the International Prevention Standards, and recent documents from WHO on adolescent health. All of those documents are now shifting the conversation towards systems-based strategies. And there were examples of systems-based strategies, but we need to know a lot more, not only in this context, but otherwise. And so we need to, and what I've tried to express there is that we have these models that look at multiple levels of influence and factors that either create protection or create risk, going out from the individual child and the family, the school, the community, and outwards into the society. But we haven't really looked at some of the concepts that are based in system science to try to apply them and measure them and look at them. And so those are some of the examples in the bullets. Measuring adopter concerns, coaching and mentoring strategies rather than implementation advice, the notion of non-rational decision-making in large systems. There's a number of concepts that can be applied from system science that needs to be thought about to make the shift between ecological analysis towards ecological action. And it's I think timely for us to think about this, not only in this context, but timely to think about how that would work or can work in low resource countries, because all of the recent documents, as noted above, are calling for this kind of systems-based approach. Is this does this capture what we think is appropriate for working towards that systems-based approach? It's a bit broader than just using a comprehensive model. It's actually looking how that comprehensive model, such as health-promoting schools or child-friendly schools, how it fits within the systems that need to operate it. Comments, suggestions, other things that are missing?
Brian Flight here. This is a tricky one, Doug, because of the evidence behind it is more of the ideological analyses rather than test evidence-based interventions. And so any approach that's tested out there is going to be new in some way.
Yes, for sure. Yeah.
Any contribution that comes will be new for all countries, not just lower resource countries.
Yes, and
in some ways it might be easier in some lower resource countries. There's a tighter integration of services generally than in some higher resource countries.
Comments from others about this? I think Brian's really identified well, maybe just to pick up on that point, I did find some materials looking at sort of systems thinking. And the initial thought was, well, maybe it's simpler because there are fewer resources and fewer players, but in fact, it might be just as complex in terms of if you look at using some of those concepts. And Brian's absolutely right. The science, quote unquote, is we haven't applied system science the way we've applied intervention science or intervention research. And so that's a real gap, not only in this context, but we need to think about using some of these ideas if we're looking to go beyond from program implementation to program sustainability, or to the sustainability of a comprehensive approach. And it's a real mind shift that it will be, first of all, it's hard to measure in research, and new things need to be developed, new methods, or old methods that have not yet been used often. And also these kinds of concepts. There's several more that do appear in the system science literature and are actually being applied in different school-based programs, but it's a very new field. Wadi or others involved in those reports, was this part of the discussion when you were writing up the analysis of an ecological approach or systems approach? Was there discussion around this?
I'm trying to follow, and I think, I mean, what is written there in terms of the logic of it is true. So, yeah, I mean, maybe Hannah would have better insight on this, but I mean, I cannot really intervene because Hannah and Yongfeng were directly implicated in the report writing, but as it is right now, I see like this is an ongoing discussion because like the concept of a system is still something that is hard to grasp. So I don't know how much I can intervene on that front myself. So
indeed, I can just agree that it's not an easy concept, and one obstacle that we came across is that it's defined so differently in different fields, and as a prevention specialist, we typically need to work across or with different professional groups, with education sector, with healthcare sector, with prevention specialists, and so on. And especially when it came to this kind of learnings from this kind of more system science, I think they seem highly interesting. But that's definitely something where work would really be still needed. And I think that was one of the learning from the guide that especially for us, just to learn how these systems in education sector are defined across different geographical regions, and you know, what could be better done to utilize those perspectives.
Yeah, sorry, this is Yongfeng. Also, I echo what Hannah and Wadi just said. It's unlike the other components of the education sector responses. Like there is really lack of so-called hard evidence about the system approach. It's just from the education sector perspective, we heard a lot about from the people, stakeholders from the education sector, seeing there are as I mentioned at the beginning, there are very good solid evidence about effective responses, effective interventions, but it's always found challenging to scale up at the national level. The obstacles are felt from many aspects of the education system, seeing from the policy level, from the teachers are not feel, even many teachers were trained, but they were not adequately supported to deliver to use what they were trained. So I think it's a more, seems to me it's a more theoretical. There are many obstacles from the different stakeholders and the subsystems of the education system to the scaling up of the effective responses. So we feel the need to have a more broader look at the sector response, but I agree with the statement shown in this slide. We do need to know more about these approaches, ecological and system-based approaches. I think this statement seems to me valid. We just need to know more and to figure out how to get that point.
Okay, well, perhaps we can, this is really a new frontier in not only for low resource countries or not only for substance abuse, but it's an area that needs to be developed. And maybe just to close it, I'm a big believer in coming back to, so what is a practical kind of thing, and identify one that when I was working in Canada, we stumbled into. We were setting up a federal provincial consortium of the provinces working on school health promotion, and because we had looked at an American we looked at an American assignment, a joint assignment of a coordinator. We required all the provinces to have the coordinator for school health jointly named by the health and education ministries. And that actually led to, I think, the ongoing stability of that structure, because it now became a new way of doing business between those ministries, because each year they had to name, or rename or confirm the jointly appointed member going to a federal provincial structure. And the joint appointment was the thing that led to joint job descriptions, joint offices, joint financing, all sorts of things. But it was really a simple little practical thing that we stumbled onto. And so that's the kind of, I think, systems-based things that we need to think about, that is part of this new frontier. But we're not going to solve we're not going to understand the new frontier by the end of this call, but I think there is agreement that is necessary to move forward on this front. Similar, I think, the integration, and I think Young Feng identified that in his remarks in the beginning, the need to fit within how school systems really work. And this slide identified some of those things. The responses to the statements said, well, what are the practicalities? So I've identified a few of those below, but again, this might be a new big idea that we need to say, yes, needs to be addressed. Although many of the reports called for concepts such as mainstreaming within the education system. Some of the documents refer to a health and all policies approach, but those documents are not necessarily looking for a bargain or reciprocity between the different sectors, so that I think is an important principle. But this is again maybe a shift in thinking towards to try to fit health and social programs like substance abuse within the context of the school system. And Young Feng, I think, did identify that as being a major part of the recent joint document. Comments on that, encouraging the engagement and integration within the education system rather than just dropping the problem on them, or as we noted in the beginning of the meeting, some lack of uptake by education systems for a variety of reasons. Is that this integration the way of helping to address that lack of engagement within low resource countries?
One kind of concluding comment from my side that we always like to emphasize is that these prevention programs also aim to make the work of schools easier, and that's the bottom line, because these programs help children to learn better. Big part of the programs we are supporting are actually reporting good outcomes in improved classroom behavior, less absenteeism, better grades in school, and of course these are good marketing arguments, even if not solutions as such, but it's marketing argument to be used while trying to solve these problems.
Thanks. Further comments or questions? Comments about integrating or partnering with school systems generally, looking beyond this draft statement on the slide here? If not, there were items. Maybe I'll move to the final slide, and it was looking at research questions, and then we'll look at next steps. So the research and data issues. I think there was one of the things that came out of all of the reports I looked at was people were looking for an ongoing discussion. They had been asked to do a report, or they had been involved in the implementation of a program, or they had developed a resource, and they were looking for fitting this into an ongoing conversation. And so that was one of the conclusions which I'd like to turn to in a moment, that item number one, of trying to engage in an ongoing conversation. And then secondly, there were several studies done about substance abuse derived from the Global Student Health Survey and the Global Youth Tobacco Survey that looked at trends. those two surveys are not done on a regular basis in most countries, and so there is a bit of a data vacuum a bit, but the analysis that was done, the reports I reviewed were very valuable and very interesting and insightful. So the suggestion that's coming out of that is can we bring those researchers and the data managers together to look at doing an ongoing exchange of knowledge derived from the data. And the example that I'm familiar with is the health behaviors of school-aged children. It's a Western European, North American consortium of researchers, and they do an excellent job of not only having the regular surveys done every 3 or 4 years, but also having regular publications analyzing different parts of the data. And it's a real source of knowledge, an increasingly important source of knowledge. And so the suggestion here was that we try to encourage the same thing for low resource countries. Are those suggestions acceptable to folks? Those findings reflect your experience? Maybe I'll move to the final slide because it really picks up on item 1, which is next steps. We'll continue to collate responses to our little survey. Several people have responded, and we'll be going back to we have about 75 people on the list thus far who have indicated that they're interested, and so we'll chase down the responses if at all possible. And then we'll draft a summary paper based on our discussion today. It has been recorded, so we'll be able to pick up on it. And really the suggestion is maybe we can open up discussion. Is there ongoing interest in a series of webinars on more particular topics, not only from low resource countries, but for substance abuse in general? And if so, we can collect names under item 3, and if you have any other suggestions, you can send them to me, and I'll share them with the group. But maybe just opening it up into a general discussion: is there interest in continuing to have a discussion about substance abuse prevention overall, and would folks be interested in working together to get that started and to do that series of webinars?
Hey, this is again Hanna from UNODC. I need to leave very, very soon, but I just wanted to say that, like we have been discussing before, for us this seems like a very nice way ahead to continue the dialogue we were able to start while we were creating the joint WHO UNESCO's guide on work focusing especially on schools, and also from our very own perspective, this is a growing area from our programmatic perspective, so we would be really delighted to do cooperation in this field. And as you were already indicating in some of your background materials, the preventionhub.org that we are hosting would be a very nice home, and we would be very happy to link these webinars and store them there. And from our side, we would be delighted to hear if others would be interested to continue the dialogue in this kind of fora.
Great, and I'm seeing the messages are coming in that people are seem to be interested, and certainly in the email correspondence I've had, people have expressed interest in doing that. So maybe we'll take it as a given, since I apologize for being well over the scheduled time, and appreciate everybody staying in as long as people have. So I think we can accept that, yes, and there's the, Hannah has posted, the preventionhub.org is a resource that UNODC is managing. So we'll pick up on this and look forward to next steps. maybe in closing, and again, first I'll apologize for the length of the time. We probably have learned a lesson here in terms of when we have a web meeting rather than a web presentation, that we need to think about having a little more time scheduled. And we'll do that for the next time if we have this format. But we'll look at putting together a series of webinars on topics of interest, and we'll do a consultation on the topics that might be of most interest. And we'll follow up with folks as we move forward. I'm also pleased to see, although our group is smaller than I had anticipated, that we had representation, I think, from all the continents except for maybe Australia, but we seem to have all the other regions of the world represented, which was great. And we'll and I know the folks who were not able to be here are all interested, and I'll be sure to bring to their attention this recording and the notes and the eventual draft summary paper. So thank you everybody for participating today, and thank you again for the kind comments on the instant message board. I think this is a good start, and thank you again for your participation and your patience. Thanks. So we'll close up the session, and I'll end the recording now.